مرحبا معكم الدكتور إبراهيم دبوس. Today we will talk about fluoride toxicity and dental fluorosis. As we said in the previous lectures, in the fluoride topic, we talked about the mechanism of action of a fluoride in the prevention of dental caries and different formulas of a fluoride that can be used in order to prevent dental caries. Fluoride toxicity could arise due to the use of a fluoride widely in order to prevent dental caries, such as fluoridated water, the use of a fluoride in prevention of dental caries, and the adding of a fluoride to different forms of food. And it could be result from inhalation of fluoride gases through the lung. Fluoride toxicity could be acute or chronic. Acute fluoride toxicity could result from ingestion or inhaling a big amount or high amount of fluoride accidentally, while the chronic fluoride toxicity could be result from ingestion lesser amount of fluoride but at longer duration of time. Dental fluorosis could be considered as a form of a fluoride toxicity that affects the teeth. The body burden of a fluoride. Body burden means the fluoride that accumulated in the body. Fluoride in the body is mainly associated with calcified tissues, such as the bone and the teeth, because the calcium ions have a high affinity to fluoride. In the addition of fluoride to bone and teeth, as we said, result in increasing the density and hardness of the bone. But this will not significantly improve the mechanical strength because we have something we call it biphasic effect of a fluoride in bone strength. This means that adding the fluoride to the calcium will increase the strength of the bone to a specific point. Then the effect of adding a fluoride on the bone will result in reducing its strength. The body burden of a fluoride divided into fluoride in hard tissue, which represented by 99% on bone and teeth, and 1% of the fluoride in the body accumulated in soft tissue and plasma. The absorption of fluoride through the gut occurs when the hydrogen fluoride is diffused directly through the stomach and the small intestine, and this occurs quickly within 20 to 60 minutes. The fluoride is absorbed through the gut in 80 to 90%, while the other 20 to 10% is excreted by feces. The fluoride that absorbed to the body is distributed and excreted from the body through the saliva to be ingested later, or sweat or urine and feces that's completely excreted out of the body. 50% of fluoride is excreted by the kidneys and urine within 24 hours. This graph represents the absorption of fluoride, as we said, within 20 to 60 minutes. The peak concentration of fluoride in the plasma will be, then it will start to reduce due to excretion process, as we said. Through the GI tract, it will transmit it in about 90% to plasma, about 10% will excrete it through feces, and the plasma is then distributed in 99% in hard tissue and 1% in soft tissues, and the rest of fluoride in plasma will be excreted mainly through the urine with a lesser amount of through the feces and sweat. The saliva excreted the fluoride excreted through the saliva will re-enter back to the GI tract to be excreted through the feces or absorbed through the saliva or through the gut to the plasma. This graph shows the metabolism of fluoride in the body. As we said, through the GI tract, about 80% will be absorbed to plasma, while 10 to 20% will be excreted through the feces. In the plasma, a significant amount will be deposited on the calcified tissue, a lesser amount on soft tissue, and these fluoride in these tissues are in equilibrium with fluoride in the plasma, while the excreted part of the plasma is secreted through the saliva back to the GI or feces or sweat or mainly through the urine. The acute toxicity result of accidental ingestion of excessive amount of fluoride. The symptoms mostly is GI and neurological symptoms. The GI symptoms including nausea, vomiting, hypersalivation, abdominal pain due to the hydraulic fluoride formation acid, and diarrhea, and the neural signs including convulsion, cardiac and respiratory failure, and may result in death. Toxicity scenarios. When we can see a case of a fluoride toxicity. In the cases of a fluoride toxicity could result from accidental or suicidal ingestion of a fluoride containing products such as insecticide, these materials used to kill insects, or dental products, whether it's toothpaste, mouthwashes, supplementary fluoride tablets, and some cases arise with cases or some cases of a fluoride toxicity result from improper fluoridated drinking water. In a process of fluoridating the drinking water, we may add a high concentration of fluoride. This will result in toxicity. The mechanism of action. The fluoride toxicity develops in a few minutes after ingestion because we said 20 minutes the peak concentration of fluoride in the plasma may need 20 to 60 minutes. The fluoride interfere with the activity of proteolytic and glycolytic enzymes. This will make a problem in the metabolism of cellular metabolism. And efflux of potassium from red blood cells, this will result in increasing the potassium level in plasma, and this will result in hyperkalemia and hypocalcemia. This table shows the different concentration of fluoride in relation to the patient weight. That represents how the body can interact with this concentration. In the first line, we can see optimal fluoride intake. It's about 0.05 to 0.07 milligram per kilogram. It is the optimal concentration of fluoride in order to prevent dental caries. And regarding the safely tolerated dose, this is the dose after it the patient may have toxicity, and below it the patient is unlikely to have toxicity. It's about 1 milligram per kilogram of the patient. This means that if the patient is 10 kilograms weight, 10 milligram of fluoride may result in above this level may result in toxicity. The potential lethal dose, it's the lowest dose associated with fatality. This means that we studied different cases of lethal cases of fluoride toxicity, and they find that the lowest dose that can be associated with fatality is 5 milligram per kilogram. Back to the same patient. If a patient is 10 kilogram weight, it's 50 milligram dose of fluoride will result in a risk of having fatality. Certain needle dose, it is a dose that survive after the patient ingest it. Survival after consuming this amount of fluoride is unlikely. It's about 32 to 64 milligram per kilogram. This means that if the patient is 10 kilogram weight, the ingestion of 32 milligram of fluoride may result in, or it certainly will result in death. This table shows different scenarios of a fluoride ingestion. If the patient ingested less than the potential lethal dose, which is 5 milligram per kilogram, we only try to reduce the absorption and delaying the absorption of fluoride to the body by giving a milk. If the patient ingests 5 to 15 milligram, which is above the potential lethal dose but below the certain lethal dose, we should try to empty the stomach from the fluoride by using different mixtures such as ipecacuanha emetic mixture, which is a herbal product added to glycerin and sugar, and ipecac syrup. These mixtures help in inducing vomiting for the patient in order to reduce the amount of ingested fluoride that absorbed to the body. In addition to the vomiting, we can give the patient milk, epsom, salt, or aluminum hydroxide antacids mixture in order to reduce the absorption of fluoride. If patient ingests more than 15 milligram of fluoride per kilogram, which is above the certain lethal dose, the patient should be urgently hospitalized into the intensive care unit in order to support the neurological, cardiac, and respiratory systems that's mostly affected by fluoride toxicity, as we said previously. But what about the fluoride formulation that can be used in dentistry? The most common formulation of fluoride that can be used in dentistry is sodium fluoride. The molar mass of the sodium fluoride, as we know, for sodium is a 23, for the fluoride is 19, and in total, the molar mass of the sodium fluoride is 42. The fluoride percent from this 42 is 19 divided by 42, it's 45% of the sodium fluoride is fluoride. This means that if we have 10 kilos of sodium fluoride, about 4.5% kilos of it is a fluoride. Regarding the sodium monofluorophosphate, also is a preparation of a fluoride that added to dental products. This is the chemical formula of it. The molar mass of this product is about 145. The fluoride represents about 19 divided by 145. It's a 13%. This means that if we have 10 kilograms of sodium monofluorophosphate, about 1.3 kilo of it is a fluoride. Regarding this, the last form of stainless fluoride is a stainless fluoride. It is stainless with fluoride. The molar mass of it is 138. About 14% of it is fluoride. This means that if we have 10 kilos of stainless fluoride, about 1.4 kilo of it is fluoride. This helps us in knowing how much fluoride is present in different dental products. About how can we measure fluoride? Fluoride can be measured in products in terms of percent, in terms of part per million, or in terms of milligram per milliliter. In case of the percent by mass mean that 1 part per 100 parts, while part per million mean every million parts contain 1 part. How can we convert percent to part per million? 1% of a fluoride to part per million, 1 per 100 part. If we multiply the 1 with 10,000 and the 100 with 10,000, it will result in 10,000 to 1 million. This means that 1% is 10,000 part per million. 1% equivalent to 1,000 part per million. From this, we can see that part per million can be converted to percent by dividing the part per million by 10,000, or the percent can be converted to part per million by multiplying it with 10,000. An example, a toothpaste containing 1,000 part per million of a fluoride. How we can convert it to the percent? The 10,000, when it's divided by 10,000, it will result in 0.1% of a fluoride. As we said, the methods of measuring fluoride is the percent, part per million, and milligram per milliliter. How we can convert the units between part per million and milligram per milliliter? As we said, the part per million by mass equal 1 liter equal 1 kilogram of water. Because the density of water is 1, this means that 1 liter equal the 1 kilogram. 1 kilogram contain 1,000 gram and 1 million milligram. This means that 1 part per million equal 1 milligram of the liter. How we can convert part per million to milligram to milliliter? 1,000 part per million equal 1,000 milligram per liter. The liter contain 1,000 milliliter. This means, as we said, 1,000 part per million equal 1,000 milligram. Instead of putting the liter, we put here 1,000 milliliter. 1,000, the zeros is cancel each other. This means that 1,000 part per million equal 1 milligram per liter. That's why if you want to convert between part per million and 1 milligram per liter, part per million to 1 milligram to milligram per liter, we should divide by 1,000. And if we want to convert milligram per milliliter to part per million, we should multiply by 1,000. An example, if we have water fluoride in water fluoridation with 1,000 part per million fluoride in water fluoridation, if we should divide it by 1,000 to convert it to milliliter, to milligram per milliliter. And if we want to convert the milligram per milliliter to part per million, we should multiply it with 1,000. And at the end, as we said, if we have a percent and we want to convert it to milligram per milliliter, the percent by concentration, how to convert the percent to milligram per milliliter? As we said, 1% of a fluoride, 1% equal 1 kilogram to 100 liter, because the density of water is 1. Each kilogram weight, each kilogram by weight equal 1 liter. If we have 1%, this means that we have 1 kilogram per 100 liter. The kilogram contain 1,000 gram, and the 100 liter stay as it is. we can cancel 2 zeros from here and 2 zeros from here. It will stay 10 grams per liter. The liter contain 1000 milliliter and the gram contain 1000 milligram. 10 grams equal 10,000 milligram and 1000 milliliter stay as it is. We cancel 3 zeros and 3 zeros. This means that 1% equal 10 milligram per mil. At the end, 10 milligram per ml is equivalent to 1%. This means that if we want to convert from milligram per milliliter to percent, we should divide by 10. And if we want to convert the percent to milligram per milliliter, we should multiply by 10. For example, if we have 5% fluoride in water, this can be converted by multiplying it with 10 to 50 milligram per milliliter. And if we have a 50 milligram per liter, if you want to convert it to the percent, we should multiply it by 5. Here is examples of a fluoride preparations. If we have 5% of sodium fluoride, as we said, sodium fluoride contain 0.45% of the sodium fluoride is a fluoride. This means that if we have 5% of sodium fluoride, by multiplying it with this number, this will result in 2.25% of the solution is a fluoride. If you want to convert it to part per million, just multiply it with 10,000. And if you want to convert this number to milligram per liter, just multiply it by 10. Back here, if you have a mouthwash containing 0.2% of sodium fluoride, we should multiply it with the ratio of a fluoride in the formula, which is 0.45. This will result in 0.09% of the solution is a fluoride. To convert it to part per million, just multiply it with 10,000. To convert it to milligram per milliliter, just multiply it with 10. At the end, in some preparation of mouthwashes that can be used daily, it's contain 0.05% of sodium fluoride. By multiplying this number with 0.45, which is represent the ratio of a fluoride in this compound, this will result in this number. If you want to convert it to part per million, just multiply it with 10,000. In order to convert it to milligram per milliliter, just multiply this number with 10. Here is an example of fluoride toxicity. If we have a child that weighs 10 kilograms and he ingested 25 ml of a toothpaste containing 1000 parts per million, how we can calculate the amount that this patient had ingested? As we said, 1500 part per million of fluoride equal to 1.5 milligram per ml. As we said, we divide this number by 1000. This means that 1.5 milligram per ml of fluoride. And because the patient is in just 25 ml of this solution, this means that the fluoride content is 1.5 milligram per ml multiplied by 25 ml equal 37.5 milligram. This is the total amount that ingested by the patient. The fluoride dose equal, in order to calculate the fluoride dose, we calculate the amount of, we divide the amount of fluoride by the patient weight, which is 10 kilogram. This results in 3.75 milligram per kilogram. This number is above the safely tolerated dose, which is 1 milligram per kilogram, but below the potential lethal dose. This means that the patient may have symptoms, but this will not result in lethal complications or the death of the patient. Now we will talk about the chronic toxicity of fluoride on teeth, which is fluorosis. Regarding the history of fluorosis, the fluorosis was firstly described by McKay in 1901, and it first reverted as a mottled enamel, and by studying this condition, he concluded that it's related to your geographic distributions, and kids born at a certain areas were affected, and he related this condition to the water source. Then Dian in 1931 described mottled enamel severity is related to the fluorine concentration in drinking water, and he concluded in 1938 that mottled enamel is caused by fluoride in drinking water, but 1 part per million of a fluoride level have no clinical effects. Fluorosis is subsurface enamel hypomineralization or porosity that occur when a child ingests above optimum amount of fluoride while enamel formation is occurring. It's clinically arise as faint white flecks or snow flaking, brown staining, pitting, which is post-eruptive damage to the severely porous and hypomineralized enamel. The treatment is related to the clinical sign. In the first 3 signs, it's the management is aesthetic, or the problem is aesthetic. In this, we can manage this aesthetic problem by a procedure called microabrasion, during which we use phosphoric acid with pumice and rub the labial surface of the tooth with the mixture of acids and pumice in order to remove a small layer, the outer layer of the enamel, and remove the defective part of enamel. In some cases, especially in the pitting level, we should treat these teeth by means of restorative. As we said, in case of pitting of enamel, we lost the integrity of the enamel, and we can restore it with composite or veneer or crown, depending on the severity of fluorosis. When I can see fluorosis in teeth, individual susceptibility can be seen. This means that a genetic effect can determine if some patients may be affected with fluorosis or not. And the fluorosis is a dose dependent. This means that if the patient intake of a fluoride is high, the risk of having fluorosis is high. The fluorosis is symmetrically distributed on teeth. This means that if we see a fluorosis on the right side central incisor, the left side central incisor almost is affected. Most commonly seen in permanent teeth, while in primary teeth it can be seen in the gingival third of the second primary molar, because this tooth is formed after the delivery, while the other teeth is formed before the delivery, because the fluoride is not easily transited by placenta, This result in lesser extent of having fluorosis in other primary teeth. But the fluorosis in primary teeth is milder than that in permanent teeth. Fluorosis in individual. Ingestion of a fluoride in the first 6 to 8 years of life. If a patient eats exposed to high concentration of fluoride for extended period of time, from 0 to 8 years old of life, there is a high risk of having fluorosis for this child. And we have a risk factors for having fluorosis in this individual. The use of toothpaste in the preschool children. The patient may swallow about 0.3 milligram each brushing. And the fluorosis, the occurrence of a fluorosis is related also to the age started brushing, because the younger child may try always to swallow the fluoride. This will increase the amount of fluoride affecting the teeth. And the frequency of brushing. Increasing the frequency increase the amount of ingested fluoride and result in fluorosis. In addition, the use of a fluoride supplement in the first 6 to 8 years old, this will result in increase the fluoride affecting the teeth. And the use of infant formulas before 1979, because infant formulas contain high amount of fluoride, and it's prepared with fluoridated water. This will result in a big amount of fluoride that's ingested daily for this patient, and increase the risk of having fluorosis. How we can modify the risk of fluorosis for individual? Firstly, the use of toothpaste. The parent should supervise children at earlier age. That's why we always instruct parent below the age of 6. It should be supervised by parent. We should control the amount of toothpaste to be a size amount if the patient is from 3 years to 6 years, and dry size if the patient is below the 3 years old. And we should instruct the patient to spit out the toothpaste. Regarding the fluoride supplement, we should always try to reduce the fluoride supplement dosage schedule in areas, especially in the area in non-fluoridated area, and it should not be used in patient in area where the water is fluoridated. Regarding infant formulas, the concentration of fluoride has been reduced by manufacturer after the 1979. Regarding fluorosis in community and water fluoridation, fluorosis can be seen if the water fluoridation is above the 1.8 part per million per day, and 19% chance if the patient is above 6 part per million per day. Cannot be protected for specific quantity. As we said, it's genetically controlled in some cases that can be affected by fluoride, and some cases may not be affected. In order to measure fluorosis, we have different scales. We have TN fluorosis index that's divided from 0, normal, questionable, very mild, moderate, and severe. The problem of this index, it's not sensitive for mild and severe forms of fluorosis, and the method of measuring it without drying the teeth, this result in very sometimes difficult to be diagnosed in the milder forms. The other index, tooth surface index of fluorosis, it's resemble the previous one, the DN index, but it is more detailed here in the severe form. This make it more accurate than the DN index. The last index is a thyrostop index. It's divided. The index is divided to 10 scales. The advantage of this method is the mild and the severe forms of fluorosis is more detailed. This allows us to differentiate between the milder and the more severe forms of fluorosis if we compare this score with the DN index. But the most important thing in different studies that if we read a study and if you want to do a study, we should be aware about the index we use in order to get a comparable results. Here is a normal tooth with pericymata seen, and the tooth, the color is here. The mild form of fluorosis, we can see the white areas here, and it is symmetrical on both sides and the here more severe form of fluorosis with here the white areas. The more severe forms here can be seen at the incisor edge, and we can see the asymmetry of having fluorosis on the teeth. And its more severe form, the white lesion is extended more on the labial surface, and we can see the line that the fluorosis may start to be affect these teeth. And here the pitting, the post-eruptive breakdown of enamel, we can see the pitting and the discoloration of the enamel at the here the normal, mild, moderate, and severe form of fluorosis. Regarding fluorosis in Jordan, a study done by Dr. Mahmoud Hamad from our university, it's measuring the prevalence and severity of dental fluorosis among a 12 years old school children in Jordan. The study found that about 80.5% of children examined show dental fluorosis. There is no significant difference between boys and girls, while children in rural area has a higher prevalence of fluorosis. About 30% of patients have fluorosis when compared with urban areas, which is about 11%, and the difference was significant, statistically significant. This may be because in rural areas the water source is, as we said in the first lecture, it could be from wells, and this area, the water from the wells, it could have higher concentration of fluoride, and this will result in more fluorosis, especially if we know that Jordan located in fluoride belt area, as we said in the first lecture, of fluoride lectures. Here, the study showed the amount of fluoride in drinking water in عمان، إربد، الزرقاء، البلقاء، المفرق، معان، الكرك والطفيلة. As we see here, the amount of fluoride in water is arranged the least in Amman and the biggest in الطفيلة. And here we can see the percent of fluoride with fluorosis. Amman is the least, about 9%. Zarqa is about 10. Irbid, Zarqa is about 11. Balqa al-Mafraq less, and the highest is the southern areas. As we said, it could be due to utilizing water from high concentration fluoridated water.